We've mentioned before that there's a large number of virologists and scientists that are looking at this virus as it emerges in all countries. And I just checked today and I saw there's more than 49,000 full genome sequences that are available that we're looking at to determine if there are changes in the virus. And as this is an RNA virus, there are changes, expected changes in them, and we're trying to determine if those changes have any impact on the way that this virus behaves. We haven't seen that yet, but we have a group of people globally who are looking at this to make sure that we are paying attention, to make sure that all of the viruses that are shared, and we're grateful for countries for sharing these sequences, determine if any of those changes will mean a different change in behavior. In terms of the potency of the virus, it's an important observation that you mentioned, and we will look into it. But we should highlight that this virus is very deadly. When it does have a chance to infect people, it can kill people. And so we want to make sure that everyone treats this virus seriously and make sure that we do everything that we can from preventing infection, and then from those that are infected to prevent those individuals from developing more severe disease.
Yeah, if I just might add, thus far at least, there is no evidence that of all of the sequences that have been generated in all of the different infections in the world that we're seeing any strain of the virus emerge that has either greater or lesser lethality or clinical impact. In fact, the virus, most mutations in viruses provide no biologic advantage to the virus, and in fact most are detrimental to the virus. But in some cases, just now and again, this is the process of evolution for all DNA and RNA-based organisms. Just now and again, a single mutation or a few mutations can result in the virus changing. And what we're always watching out for is any change that changes the clinical impact of the disease, makes it less or more virulent, but also changes that might reduce the effectiveness of therapeutics or vaccines, or that might affect transmissibility or likelihood of transmission or the route of transmission. Or, in this case too, changes to the virus can reduce the effectiveness of our testing, because our tests are based on recognizing very often the genetic sequence of the virus. So we constantly monitoring the genetic sequences because it can affect diagnosis, it can affect treatment, it can affect vaccines, and it can affect the clinical impact of the disease and the patterns of spread. So because of that, we maintain very strong vigilance with the network of virologists and others around the world. In fact, I think within the laboratory working group there is, Maria and the team have put together a very specific group of virologists and genetic experts who are constantly reviewing the sequences and looking out for exactly those signals that you mentioned. But with regard to the real-world observations, we are not observing a significant difference in behaviour of this virus in any of the areas that I mentioned, either in terms of its transmission, its clinical lethality, in our diagnostic capacities, nor in the impact of therapeutics.
Thank you, Dr. Ryan. We will now take a question from